Welcome dear students for another online lecture class session from the Department of Pediatrics and Preventive Dentistry. So I am Dr. Jay Ganesh, who's trying to take an interesting lecture class on antibiotics and analgesics used in pediatric dentistry. So students, don't worry, I am not going to teach a pharmacological subject here, and I'm not going to go in depth in the theory of these drugs. I have tried to make this presentation a more innovative one. So let us go into this topic. So first of all, as a dentist, nowadays we are more relying on drugs. We think that if any mistakes or any improper treatment which we do in the patient, we think that we'll manage it with the drugs, which is actually not the correct one, because as we all know, drugs are also chemicals. So these chemicals have good effects as well as most of the chemicals have bad effects. So what I mean to say here is the side effects. So chemicals have side effects in the body. Then why we are using this regularly? To understand more about the rationale and the use of antibiotics and analgesics in pediatric industry, we have to know some of the common facts which govern the use of antibiotics. So let us see some of the important facts or some important points which we should understand first. So let us see the first one. A child in the mother's womb is said to be sterile without any microorganisms. But when the child is out of the mother, it will be invaded by microorganisms. What I mean to say here is the delivery time. So when a child is born by normal delivery, he or she will be encountered by millions of microorganisms, and in turn the immune system of the child will have a rapid growth and it improves. Whereas in case of a C-section delivery, the child is taken from the mother in a sterile manner, so that initial boost of immune response will not be there in those child. So this context is very important to understand the nature of the immune system. So now let us see what are the good and the bad bacteria present in the oral cavity. So oral cavity, which is the house for many microorganisms. So the good microorganisms are called as commensals. The property of these commensals is to maintain a normal oral flora and homeostasis in the oral cavity. So some of the examples of these commensals are Lactobacillus, Bifidobacterium, Staphylococcus salivarius, Bacteroids, etc. So what happens to these commensals is, when they are invaded by a harmful microorganism, it behaves in a badder way. An example I can give you. So dental caries, the common microorganism which causes dental caries என்னன்னு பார்த்தீங்கன்னா, first one is Streptococcus mutans. That is primary. Secondary, there are microorganisms which are Streptococcus sabrinus, Streptococcus rati, and also Lactobacillus. So Lactobacillus இப்போ தான் நான் commensals சொன்னேன், ஆனால் அது சடனாக ஒரு கேரிஸ் ப்ரொடியூசிங் பாக்டீரியாவை மாறுது. அது காரணம் என்னவென்றால், Streptococcus mutans, due to its virulence property, it influences the lactobacillus and make it to produce lactic acid. So this acid secreting property makes the microorganism a bad bacteria. So to understand this, I would like to tell you one more concept, that is the state of dominance. In the oral cavity, millions of microorganisms are there, but suddenly it listens to one leader. That is because of the CFU, colony forming unit. When the microorganism has a majority in number, that is the colony forming unit of the microorganism is more, and it is said to dominate the other microorganisms. So in that condition, all the other microorganisms will listen to the dominant form of the microorganisms. That's why the caries producing microorganisms also is called as Streptococcus mutant. So with this, we are going to see one more thing. All antibiotics can be called as the agent 47, hitman, because it doesn't know whom to kill, whom not to kill. So as a whole microorganism, even the good and the bad microorganisms will be encountered by antibiotics. So collectively what happens is the normal homeostasis in the oral cavity, normal flora is disturbed. So this is one of the factor which you should always remember. All antibiotics and all the time antibiotics is not good. So next one is antibiotic resistance. So as I told you, some of the microorganisms evolve. The same drug which was given in 1940 can't be given in 2020. By the time the microorganisms would have evolved at least 20-25 times. So what happens by this evolution? Let us see an example with our prime microorganism, that is Streptococcus mutans. So Streptococcus mutans generates a property of acidurance, acidogenicity and virulence enhancement. What is acidurance? The ability to withstand acid. What is acidogenicity? The ability to produce acid. What is virulence enhancement? So acids can kill a microorganism. No, இப்போ ஒரு cavity ஒரு oral cavityல acid இருக்கு. இந்த acid it can kill the same microorganisms. But what it does is it enhances virulence property. என்ன பண்ணும்னா it is called as proton pump. What a microorganism do in the cell wall of the microorganism இருக்குல்ல அதில் positive proton is plus positive proton it pumps out. So collectively the nucleus of the cell wall of the microorganism will become negative. So since the acid is also negative, they will withstand. So this is the survival property of microorganisms. So in all these ways, these microorganisms still starts to multiply in the oral cavity. So now what this antibiotics can do? So while you're keeping on thinking, let us go to the next slide. Next slide, you can ask me, என்ன சார் எப்போ பார்த்தாலும் ஆன்டிபயோட்டிக்குன்றீங்களே, உடம்புன்னு ஒன்று இருக்குது, அதில் இம்யூன் சிஸ்டம்னு ஒன்று இருக்கே, அது ஒன்றுமே பண்ணலையா, அது தூங்கின்னு இருக்கா? ஆமாங்க, அது தூங்கின்னு தான் இருக்குது. ஏன் அப்படின்னு கேட்டிங்கன்னா, இட் நீட்ஸ் டைம். என் டைம் கொடுத்தீங்கன்னா நான் உங்களுக்கு வேலை செய்கிறேன் அப்படின்னு நான் சொல்லுது. ஆனால் நம்ம ஜுரம் வந்திருக்கு, ஒரு 3 நாள் 2 நாள் ஜுரம் வெயிட் பண்ணுவோம், பார்ப்போம். 3ஆம் நாள் என்ன பண்ணுவோம், நம்ம மாத்திரை போட்டுவோம். ஏன்னா நம்மளால் வெயிட் பண்ண முடியாது, நம்மளுக்கு வேலை இருக்குது. ஸோ அதனால் இம்யூன் சிஸ்டம் என்னன்னா இட் நீட்ஸ் டைம். ஒரு ஜஸ்ட் நட்சல் now I would like to tell you about the immune system. So very interesting one. So first of all, whenever an antigen, that is microorganisms, it can be microorganisms, encounters the body, APC, அது வந்து antigen presenting cell, MHC, that's major histocompatibility complex, இது என்ன பண்ணுன்னா ஆன்டிஜனை போய் எம்ஹெச்சி கிட்ட கொடுக்கும். எம்ஹெச்சி ஒன்றும் இல்லை, எம்ஹெச்சி தான் நம்மளோட ஏர்போர்ட் ஆஃபீஸ் மாதிரி. அங்கே செக் பண்ணுறாங்க இது என்னன்னு. இது பார்க்குறப்போ நம்ம CD4, தட் இஸ் டி ஹெல்பர் செல், அவர் தான் வராது, அவர் தான் ஆஃபீஸரு, செக் பண்ணுற ஆஃபீஸர். அவர் செக் பண்ணி பார்க்குறப்போ இந்த ஆள் அவரோட டேட்டா பேஸில் இருந்தாருன்னா அவர் என்ன பண்ணுறாரு, டைரெக்டாக இவன் கெட்டவன் சொல்லி நாக் அவுட் பண்ணி சாவச்சிடுறாரு. யார்கிட்ட, நம்ம டி கில்லர் செல்ஸ் ஆஃபீஸர் 2 கிட்ட சொல்லி தே ஆர் கில்லிங், டெர்மினேட்டிங் மைக்ரோஆர்கனிசம்ஸ், தட் இஸ் த ஆன்டிஜன். இதே டி ஹெல்பர் செல்ஸுக்கு அவர் யாருன்னு தெரியல, அவர் டேட்டா பேஸில் இவங்க யாருன்னு புரியலன்னா அவர் 2 things தே கேன் டூ. ஒன் இஸ் டி ஹெல்பர் செல்ஸ் என்ன பண்ணுதுன்னா மேக்ரோபேஜஸ் கிட்ட விட்டுறாரு. மேக்ரோபேஜஸ் விஜிலன்ஸ் டிபார்ட்மெண்ட் மாதிரி. அது என்ன பண்ணுது, அதை உத்து பார்க்கும், என்கல்ஃப் பண்ணும். பாகோசைட்டோசிஸ் இந்த ப்ராசஸ் மூலயமா அதை செல் டைஜஷன் பண்ணி அதை டிஸப்பியர் பண்ணிடும். ஸோ இது ஒரு ப்ராசஸ். இது செல் பேஸ்ட் இம்யூனிட்டி. நெக்ஸ்ட் வந்து டி ஹெல்பர் செல்ஸ் அவர்கிட்ட விடுறதுக்கு பதில் பி செல்ஸ் கிட்ட ஹி வில் கிவ். பி செல்ஸ் வந்து போலீஸ் ஆஃபீஸர். போலீஸ் ஆஃபீஸர் என்ன பண்ணுவார்னா, ஆல்ரெடி நம்மக்கிட்ட இந்த பற்றி ரெக்கார்ட்ஸ் இருக்கா, அதாவது ஆன்டிபயோட்டிக்ஸ் இருக்கா, ஆன்டிபாடிஸ் இருக்கான்னு பார்ப்பார். ஃபார் எக்ஸாம்பிள் வேக்சினேஷன். நம்ம ஒரு சைல்டுக்கு என்ன பண்ணுறோம், வென் இட் இஸ் ஹி ஆர் ஷி இஸ் பார்ன், நம்ம வேக்சின் கொடுக்குறோம். வேக்சின் வந்து இட்ஸ் நத்திங் பட் இட் இஸ் அ ஸ்மாலர் டோஸ் ஆஃப் ஆன்டிஜன். அதாவது வி ஆர் கிவிங் அ ஆன்டிஜன், harmful antigen to the child to develop the immunity against it in future. அதான் வைரஸ், அதுதான் வந்து வேக்சின். ஸோ இந்த போலீஸ் நம்ம பி செல்ஸ் கிட்ட கொடுக்கும்போது அவர் பார்க்குறாரு, ஸோ வேக்சின் என்ன இருக்கா நம்மக்கிட்ட, இவர் அழிக்கிறதுக்கு நம்மக்கிட்ட வேற என்ன தந்திரம் இருக்கான்னு பார்க்குறாரு. இருந்தால் அவர் அழிச்சிடறாரு. ஸோ இதோட இந்த இம்யூன் சிஸ்டமோட ஒர்க் ஓவர். ஆனால் இதெல்லாம் பண்ணுறதுக்கு, இதெல்லாம் பண்ணி முடிக்கிறதுக்கு, நம்பர் 1, he or she should have a good immune system. That's why I told you about the normal delivery and cesarean delivery. Clinically, it has been proven that vaginal delivery, that is a normal delivery, will be having a good immune system. So, under my condition, any microorganism is there, the immune system itself will be having a tendency to manage the condition. ஆனால் immune system வந்து poor-ஆக இருக்குது. இல்லைனா in some cases where a child may have some systemic condition and he or she will be taking steroids. The steroids எல்லாம் எடுத்துருந்தா immune system suppress ஆயிடும். அப்போ ultimately we should rely more on the antibiotics. The conclusion which I would like to say here is, whenever the immune system is compromised, we need a high importance. He or she should depend on antibiotics to invade, to safeguard them from the bacterial infections. இதுவே in case of a good immune system, the immune system tend to counteract the situation. இதுதான் வந்து one of the important thing which I would like to insist. Next thing, number 7. So regular use of antibiotics hampers the development of the immune system in a child. That is what I meant to say. ஸோ ரெகுலராக நம்ம ஒரு குழந்தைக்கு வந்து ஜுரம், ஆன்டிபயோட்டிக் கொடுங்க பண்ணனா அது இம்யூன் சிஸ்டம் கண்டிப்பாக ஹேம்பர் ஆகிடும். வி ஷுட் லெட் த சைல்ட் டு டெவலப் த இம்யூன் சிஸ்டம் இன் அ நேச்சுரல் வே. ஸோ அதுதான் ஐ மீன் டு சே. ஸோ நெக்ஸ்ட் நம்பர் 8, மெக்கானிசம் ஆஃப் ஆன்டிபயோட்டிக் ஆக்ஷன். ஸோ நம்ம ஆன்டிபயோட்டிக் ரொம்ப நாள் பேசிட்டோம், அதோட மெக்கானிசம் ஆக்ஷன் என்ன பார்ப்போம். ஸோ எப்படி இந்த மைக்ரோஆர்கனிசமாக ஒரு ஆன்டிபயோட்டிக் சாகடிக்குது, ஹவு இட் இன்ஹிபிட்ஸ் த மைக்ரோஆர்கனிசம்ஸ், அதை பார்க்கறதுக்கு. ஸோ வாட் இட் டஸ் இஸ், இட் இன்ஹிபிட்ஸ் த ப்ரோட்டீன் சிந்தசிஸ். நெக்ஸ்ட் it inhibits the nucleic acid synthesis. It inhibits the cell wall synthesis. So disruption of the membrane function, block pathway and inhibits metabolism. ஸோ இந்த மாதிரி கொடுமைகள்லாம் பண்ணி நம்ம ஆன்டிபயோட்டிக்கு ஒரு மைக்ரோஆர்கனிசமை சாகடிக்குது. ஸோ லெட் அஸ் see the point number 9. So as I told you, oral cavity நிறைய மைக்ரோஆர்கனிசம் இருக்குது. Some of the microorganisms which are responsible for Alzheimer's disease, cardiovascular disease, cystic fibrosis, esophageal cancer, colorectal cancer, diabetes, pancreatic cancer, rheumatoid arthritis, நம்ம dental featureல periodontitis, dental caries, all the organisms are present in the oral cavity. So if the oral cavity is not maintained properly, when these microorganisms in the oral cavity invade the blood vessels, it can be harbored or seeded to different parts of the organs, causing all these problems. So, the importance of dentists come into play. So, as a dentist, we stand in forefront zone, that is first phase, to stop all this complication by just maintaining a proper oral cavity. So antibiotics nam solrom. So antibiotics can be prevented, the use of antibiotics can be prevented by a dentist when a normal oral cavity with the normal hygiene, with a good hygiene in fact is maintained. So next point, number 10. Virusum bacterium ஒன்றும் இல்லை, அது different entity. So virus பார்த்தீங்கன்னா it is a non-living organism. ஆனால் bacteria is living organism. Virus வந்து dominant phase-ல இருக்கும். And when it combines to host, in the host it starts to develop and it dominates the host, it controls the host. Bacteria அப்படி இல்லை, அது ஒரு localized lesion-ஆக இருக்கும். It has its property in the localized area and it doesn't control the normal property of the body. Only the immune response, the inflammatory response will be there in case of bacterial infection. And a virus rules the body and makes the body to depend on them. Next, virus are submicroscopic. Bacteria are giant when compared to virus. Next point, a virus infection can multiply thousands, leaving the host cell infected from other cell of the body. அதாவது the virus is a systemic disease, virus infection, whereas bacterial infection is a localized disease, as I told you before. So some of the systemic diseases caused by virus includes influenza, measles, polio, AIDS, and the latest trending topic, COVID-19. So bacterial disease causes pneumonia, tuberculosis, tetanus, and food poisoning. So one more fact which I would like to tell you is there is no drugs for virus. So virus has to be encountered by the immune system. So immune system has to develop in such a way it should encounter the virus. So with these ideas, let us go into the topic of the antibiotic. So as per definition, antibiotics are chemical substance derived from microorganisms, fungus or bacteria, are produced by chemical synthesis that kills or inhibits growth of other bacteria in vitro and in vivo, selectively at low concentrations. So let us see the classification of antibiotic. Based on the mode of action, they are classified into bacteriostatic and bactericidal. Based on the spectrum of action, they are classified into broad spectrum and narrow spectrum. So what is bactericidal and bacteriostatic? So bactericidal is a property of killing the bacteria. Bacteriostatic is the property of preventing the bacteria from multiplying, keeping the bacteria in a dormant state. That is bacteriostatic. So antibiotic has these two properties. So based on which antibiotic is required to kill which organism, we have to select. So some of the example of bacteriostatic antibiotics are chloramphenicol, clindamycin, tetracycline, etc. So some of the examples of bactericidal action of antibiotics are aminoglycerides, beta-lactams, metronidazole, etc. So next classification is the broad spectrum, narrow spectrum. So some of the example of the bad spectrum antibiotics, broad spectrum antibiotics are cephalosporins, etc. The second and third generation of cephalosporins. Whereas narrow spectrum, that is penicillin V, penicillin G, streptogramins, etc. So what is this broad spectrum, narrow spectrum? Broad spectrum, அப்போ நிறைய மைக்ரோஆர்கனிசம்ஸ் வச்சிரும், அப்போ அதுதான் பெஸ்ட்டு நம்ம செலக்ட் பண்ணுறது. இட்ஸ் நாட் குட். தட்ஸ் வை in the previous to understand slides நான் 10 பாயிண்ட்ஸில் கொடுத்துட்டு ஒன் ஆஃப் த பாயிண்ட் என்ன கொடுத்தேன், நார்மல் commensal should not be encountered by microorganisms. ஸோ அந்த ரீசனுக்காக நம்ம வந்து இட்ஸ் ஆல்வேஸ் ப்ரிஃபரபிள் unless and until it is a very severe infection, we should try to give a narrow spectrum antibiotics. Some of the narrow spectrum antibiotics are penicillin. The penicillin, most common thing which we are giving is the amoxicillin. So likewise, we have to prefer always narrow spectrum antibiotics. So இதில் என்ன கொடுத்துருக்குன்னு பார்த்தீங்கன்னா, broad spectrum antibiotic refer to an antibiotic that acts against a wide range of disease causing bacteria, which acts against both gram positive, gram negative bacteria, in contrast to the narrow spectrum, which is effective against specific families of bacteria. So broad spectrum antibiotics can change the body's normal microbial content by attacking indiscriminately both the pathological, naturally occurring, beneficial or harmless bacteria found in the intestine, lungs and bladder. So for this reason, in case of superinfection, severe infection, uncontrolled infection, or infection over a long period of time can be encountered by a broad spectrum. Unnecessarily நம்ம நேர ஸ்பெக்ட்ரம் ஆன்டிபயோட்டிக் தான் நம்ம வந்து ப்ரிஃபர் பண்ணோம். unnecessarily broad spectrum பண்ணக்கூடாது. So this is the point to understand. So there are different classes of antibiotics. Just an overview, ரொம்ப pharmacological போல நான். So beta lactams. So beta lactams is an important class of antibiotic which is used for dental implication. அதை விட்டால் நம்ம வந்து ஏன்னா அதை தான் பென்சிலின் டெரிவேட்டிவ்ஸ் எல்லாமே வந்து அமாக்சிலின் பென்சிலின் டெலிவரி எல்லாமே பீட்டா லாக்டம்ஸ்லாம் இருக்குது. ஸோ அதை விட்டால் நம்ம நெக்ஸ்ட்டு வந்து அமினோ கிளைகோசைட்ஸ் நம்ம வந்து டென்டல் இம்ப்ளிகேஷன் யூஸ் பண்ணுறோம். அப்புறம் வந்து நம்ம மேக்ரோலிட்ஸ் யூஸ் பண்ணுறோம். மேக்ரோலிட்ஸ் மெட்ரோனிடோல் இருக்குது, மெட்ரோனிடோல் we are using. Then we are using also quinolones in some condition because ciprofloxacin can be used in triple antibiotic paste, so that is used, and also sulfonamides and tetracycline. So apart from these, the other classes of antibiotics were not widely employed for a dental infection, bacterial infection. So an overview. So what and all we are using: beta lactams, aminoglycidates, glycosides, quinolones, sulfonamides, tetracycline, and macrolides. So all these are used for dental implications. So drug dosage. Children are not young adult. The physiology and anatomy of child differs. ஸோ நம்ம என்ன பண்ணுவோம், ஒரு சைல்டு வருது, அந்த சைல்டு வந்து ஒரு ஆன்டிபயோட்டிக் கொடுக்கணும்னு சொல்கிறோம். ஸோ நம்மக்கிட்ட ஆன்டிபயோட்டிக் சைல்டு டோஸ் இல்லை, அடல்ட் டோஸ் தான் இருக்குது, பாதி சாப்பிடு அப்படின்னு சொல்லிடுவோம், விச் இஸ் ஆக்சுவலி a wrong method to be followed. So accurate method to be followed is by implication of formulas. So two formulas are primarily used for drug dosage calculation. They are Clark's rule and Young's rule. Clark's rule is weight by 150 into adult dose is equal to the dose for the adult. That is simple formula. And next is the Young's formula, which is widely used. That is age by age plus 12 into the adult dose, which gives you the dose for a child. So all these things are widely used for drug delivery in a child. But when it comes to dental conditions, more or less adult as well as child have similar microorganisms invasion. That is most commonly by, in case of dental caries, it is by Streptococcus mutans. In case of gingival problem, it can be actinomycin committens. So in these conditions, when the microorganisms are generalized, we can more often use a narrow spectrum antibiotic to counteract the situation. So next is, in pediatric dentistry, it is very important to follow what the ethics says and the head office says. So our head office here is the American Academy of Pediatric Dentistry. They have given the conditions where you should give an antibiotic in children. So the first thing is a oral wound. So when there is an open wound due to dental trauma, the host is in the risk of infection, high infection. So he or she should be given antibiotic. Next is in case of dental pulpitis, apical periodontitis, draining sinus tract, localized intraoral swelling. In all these cases, there will be acute symptom of infection, bacterial infection in the child. So in these cases, the antibiotics are mandatory. So next is the acute facial swelling or of dental origin. Due to decay, the decay is left unnoticed, it becomes dental pulpitis, and again the pulpitis in turn become an abscess. The abscess will go have a dentoalveolar abscess, become a dentoalveolar abscess, and causes swelling, extraoral swelling. So when this extraoral swelling is due to the dental origin, ultimately the use of antibiotics is very important. Next is pediatric periodontal disease. When there's juvenile periodontitis or a masochistic habit which leads to harboring of microorganisms in the periodontal fibers causing the gum problem. So in these conditions, the microorganisms has to be eliminated from the periodontal ligament area. So the use of micro antibiotics is important. Next is salivary gland infection. So when the microorganisms invade the salivary glands, there will be swelling of the glands, in turn causes infection and decrease in the production of saliva. So to counteract this condition, again antibiotics has an important role. So coming to the antibiotic regimen. So this is actually a regimen which we follow in the department. So there are, as I told you, there are many microorganisms and many antibiotics also. So to choose which antibiotic for which microorganisms, it's our decision. So our decision should help or to aid in the development of the immunity of the child. So we can't give any antibiotics which disturbs the normal homeostasis also. So these are some of the regimen which we follow in the department. So when there's a mild to moderate condition of infection, that is or abscess, sinus opening, gingival infections, we will give cap amoxicillin 250 mg, cap or tablet amoxicillin 125 mg, tab metronidazole 200 mg, syrup amox 125 mg, syrup amoxicillin 250 mg, tab amoxicillin calumet potassium 375 mg. All these things are given in case of mild to moderate condition. Moderate to severe condition irradiation, space infection, extravascular swelling, chronic abscess, accompanied medical condition is suspension, amoxicillin calumet potassium 457 mg. That is also called as Advent-Fort syrup, which can be given. Cap amoxicillin 500 mg, tab metronidazole 400 mg, tab doxycycline 100 mg can be given. And what are the other antibiotics which we do in the procedure-wise management? That is LSTR. LSTR is defined as lesion sterilization tissue repair. In case of a long-lasting abscess condition, especially in case of the anterior tooth, so where the pus accumulation is there in the periapical area, after draining the pus through access opening, we have to do a procedure called as LSTR. For which a 3-mix paste is used. That is triple antibiotic paste is used. So the antibiotic regimen which is used here is tablet ciprofloxacin 500 mg, tablet metronidazole 400 mg, tablet doxycycline 100 mg, which is mashed into powder, and with the help of a saline or any other vehicle, it is obturated into the canals, and hence the antibiotic activity is established in the canals of the infected tooth. Next is the topical application. Ointment which is used is metronidazole gel, which is a topical antibiotic gel which is commonly used in case of abscess ulcer or any other oral lesions present in the oral cavity. So with this, we are going to the next topic, that is the analgesic. So analgesic are medicines that are used to relieve pain. They are also known as painkillers or pain relievers. Technically, the term analgesic refers to a medication that provides relief from pain without putting you to sleep or making you to lose consciousness. So coming to classification, they are basically classified into opioid analgesic and non-opioid analgesic. So opioid analgesic is narcotics, morphine-like analgesic. Non-opioid are NSAIDs, narcotics, aspirin-like analgesic. அதாவது இந்த ஓபியட் when in the case of in time of World War I, II, நம்ம வந்து ஜாஸ்தியாக வந்து இந்த ஃபர்ஸ்ட் டைப் தான் யூஸ் பண்ணியிருந்தாங்க. பட் இட் ஹேஸ் லாட்ஸ் ஆஃப் implication, side effects as well as addiction. Because of all this reason, the second type of analgesic started to come into play. As NSAIDs are widely used drugs in dental conditions, it is critical and important for us to know the classification of the same. So the NSAIDs are classified into non-selective COX inhibitors, and the category which comes with this drug lists are the salicylates, that is aspirin, acetic acid derivative, ketorolac, which is gaining the competition and coming as an effective painkiller in dental conditions. Next is the pyrazolone derivatives, the propionic acid derivatives. In that, ibuprofen was widely used. Now, ibuprofen is having some serious issues with the side effects, so it is not widely employed. However, in milder cases and in young children, it has been employed. So, phenamate, an enolic acid derivative, piroxicam, which is again next newer version of painkiller, which is started to establish for dental implications. Next is a preferential COX-2 inhibitor, that is nimesulide, diclofenac, aceclofenac, which is widely used. In a selective COX-2 inhibitor, there is the celecoxib, which is being used. The other entities are not widely established. And the last and very important classification is the antibiotic with poor anti-inflammatory action classification. The example in this is the paracetamol, which is having a very important usage in dental implication, especially in case of children's. So, it is important for us to know the pathway of NSAID. So, NSAID inhibits the cyclooxygenase pathway. So, cyclooxygenase is the enzyme which is responsible for initiating the prostaglandin secretion due to physiological or pathological infection or trauma. So, when prostaglandin is synthesized, it initiates the inflammatory process. As we all know, the cardinal signs of inflammation are Ruber, Calor, dolor and tumor. So, dolor is the pain. So, when this prostaglandin is produced, there will be pain. So, to prevent this, NSAID inhibits the COX-1, COX-2. So, collectively, the prostaglandins won't be produced. So, when the prostaglandin is not produced, the pain will not be there. So, this is just a small way of explaining the NSAID action. So, these are the list of commonly used analgesic in the department. When the age of the child is less than 5 years, tablet paracetamol 125 mg or 250 mg, syrup paracetamol 125 mg or 250 mg, syrup ibuprofen 100 mg. And when the age of the child is above 5 years, tab paracetamol 250 mg, tab ibuprofen 100 mg, syrup paracetamol 250 mg, tab aceclofenac or diclofenac 50 mg, tab combiflam, that is a combination of paracetamol and ibuprofen, can be used as a topical ointment or gel. Choline salicylate and lignocaine gel can be used as a topical analgesic and NSAID gel in case of abscess ulcer or oral lesion, and benzalkonium plus choline salicylate plus lignocaine also is a non-opioid analgesic and antibiotic, which also can be used for the same conditions. So, I would like to say, when most of the drugs have side effects, it is always our duty to minimize the use of these drugs, especially in case of children. And one more important thing is, the drugs which we have listed in the department is always subjected for updation, because there are always newer variety of drug invented every day, and different microorganisms, newer variant also evolves every day. So, it is always important for us to update yourself with the latest innovations. So, with this, I complete this chapter by saying, keep calm and start updating yourself. Thank you. So, for any queries and doubt, you can feel free to contact me. Complete the MCQs and submit them on time. Thank you.